has what's called the Morel-Lavallée lesion. Essentially what's happened is the patient had a shearing injury that resulted in what we call perforators, which are blood vessels that go from the fascia to the skin being ripped. And a potential space is created that then fills with fluid. These patients are often misdiagnosed and they just keep getting recurrent drainage procedures performed, and it just keeps coming back because there's a balloon essentially that forms called a capsule, and that balloon just keeps refilling. So what we've done here so far is we basically dissected out the entire balloon, and then I made a small hole up here. We had immediate evacuation of a lot of fluid, and I made this hole so that I could actually feel the extent of the balloon. So now with my finger inside the lesion, I'm going to continue my dissection so that I make sure I get this entire capsule out and prevent this from happening again. So we now have the entire lesion out, and as you can see, before this was filled with fluid and was very big. I'm just going to show you kind of the inside of this, so I'm going to go ahead and open this up, and you can see how thick this capsule becomes with time. And that's why these just consistently fill with fluid, and you can't just empty the fluid, you actually have to cut it out. And as you can see on the inside, it forms this rind, and this just continuously accumulates fluid unless somebody like me comes along and excises the whole specimen. So we're going to go ahead and send this for permanent pathology just to be safe, make sure there's nothing crazy about this, but this is pretty classic for a chronic Morel-Lavallée and seroma lesion. We've shelled out that entire lesion. This is all normal subcutaneous tissue or fat, but you can see it basically created what we call tissue expansion. So that balloon continuously filled with fluid and actually expanded the skin of this gentleman's thigh. So the next step now will be to essentially contour this thigh by removing the redundant skin and then closing over a drain to make sure this does not come back.